Hello, Dr. Tretti.
Hello, Dr. Min. How are you doing?
Fine. How's the Seoul? When do you arrive Seoul?
Oh, I arrived yesterday morning after a very long trip from Paris. But it was very nice, nice city, nice people, nice food. So that's fine.
I know you visited Seoul 5 years ago.
Yes.
And any changes between since then? Seoul?
Regarding the city or?
The city and atmosphere, the people?
The atmosphere is better now, I think. I mean, it's probably because that time I was, was my first time, so probably because of me, not because of the Korean people. The ambient is very good. So the meeting I attended during these 2 days is very interesting. Very high level topic, very good speakers. So, that is a lot of my friends ask me, "Oh, Matteo, why do you have to travel for 13 hours to attend a meeting?" And I said, "Okay, I saw so many big names on the program, so why not?" And I agree that the level of the topic was really good.
Yeah, in this meeting, the conference, we try to give very hard attention on this meeting because for 3 years, the pandemic, we cannot open any conferences. And the Korean beauty market is very important for the Korean doctors, and I think it is very important for the worldwide doctors, the countries. And I want to ask about compare with the interview with Medical Aesthetics 5 years ago, and how would you describe the Korean beauty market has changed since then?
One thing surprised me, means there is a big attention to the tightening devices. That last time was less. This is my feeling staying here only few days, but I think that they have not to forget the quality of the skin. So the other things I noted is younger people around, in comparison with the other time. So or because I'm becoming older, I don't know, but younger people. And this is the thing. I saw many devices in the exhibition hall regarding tightening devices. I think that is nice. That is good. And we need them, but we have not to forget that there's also we have to put a great attention to the quality of the skin. And lasers are still, in my opinion, the best thing to choose as devices in the office of a person who has to start this activity.
In Korea, there is some trend because many patients opt for lifting and tightening procedures, even in the absence of significant wrinkles or sagging skin. And in Korea, this referred to as a preventive aesthetic medicine. Then you think it's a new trend in about in Italian aesthetic trend compared with the Italian trend? What's your opinion about this trend in Korea?
There isn't a preventive surgical approach, so we have to forget surgery. Surgery, you have to do surgery when you need surgery. So there's no sense doing a facelift today if you want to prevent the aging, sagging in the next 20 years. Complete different topics is to use devices as well as topicals, as well as a good daily routine to try to keep the situation. Okay, to keep the situation under control. So this is the thing. I started to see, I do not know here in Korea, but I think so, younger people coming and they are realizing they do not have defects in their face. Yeah, so right. Naturally, if they have defects, that is another thing. But they are serious, they are honest, they are saying, oh doctor, I know that I do not have the defect, but I want to start to do something to keep this situation. And I think that the pandemic increased a lot this thing, because, you know, I was calling the pandemic as the Zoom era or the Teams era. You know, we had a lot of meetings and meetings through the screen. Okay,
right.
So
online meetings.
People without the dress and only the face on the screen, and so. Many of my patients are saying, oh doctor, I have a lot of these meetings and so I look at my face and I don't like my face, or can we do something better? Before pandemic was not like this. So I think that you know, helping the body to keeping the same amount of collagen, or to produce new collagen, or to reduce the aging process, regarding the surface as well as the deep layers of the skin, that could be a good thing, together with a good daily routine. That's, you know, for me is mandatory for all people, you know.
But you are a plastic surgeon, right?
I'm a plastic surgeon.
But this trend go against traditional surgery center approaches. So as a plastic surgeon, what are your thoughts on this shift? And it is very desirable, or is not very, you know, the surgery is a very definite, it has very definite results, but this kind of the procedures, these several sessions and very minor changes, but in the some future points, it can be a very good way to go. Or
we cannot achieve the same results with devices as we can do with surgery, and therefore it's like mixing apple with peaches. So we are speaking two different languages. Okay, if you have a very sagging skin, the only thing to do is surgery. And you cannot achieve the same results doing tons of non-aggressive procedures. This is the first thing. So, and the advantage is that if you start to think about the quality of your skin and the aspect of your face and the shape of your soft tissues when you are in your 25, 30s, probably you will be a candidate, or you will accept better the eventual surgical approach later. So I do not think that the way is or A or B. No, I do not agree. I think that taking care, I have a lot of patients that already did surgery and they want to keep the results of surgery. Or I have patients saying, oh doctor, I do not want to go to the surgical room now, maybe in a few years, but what can I do to try to keep results and to try to keep the aspect of my face? The second thing that is very important is that surgery is not able at all to modify the surface, the aspect of the surface. If you have a patient with a lot of blemishes, with red color of the skin, surgery cannot do anything. So I never thought that these two components are, you know, in fighting themselves. No, I don't think so. They are helping themselves. We must be honest with our patients, saying, okay, you have a very severe sagging skin. Our devices, our injections cannot do too much. On the other side, if you start to take care of your face or your body when you are younger than before, probably your mind is more prone to accept or willing to accept eventually a surgical approach. So I do not think that these two elements are in contrast.
I know that you have a laser plastic clinic in Italy, right? And can you tell me about your daily practice, the main treatments you provide, and the equipment you have?
How much time do I have? No. I opened my new office, unfortunately, just few months before COVID. So at the beginning was not so easy, but I decided to have my home theater, and I decided that I do not want to work alone. I love to have other doctors around to create a team. You know, I'm proud to say that I have an A team.
Oh,
so
wow.
all of them are really skillful on different topics, and therefore I think that this is a great. You know, a team will go farther than a single doctor. Everyday activity depends on the season. For example, there are seasons where we are not doing a lot of ablative surgeries, ablative lasers procedures, because because of the sun, because they want to go to vacation. And there are periods of the year where the ablative lasers are the most important one. So I always have injections during the day. I mean, some, few botulinum toxin or filler injection. But it depends on the part of the year. I think that I have a couple of devices that I switch on every morning when I arrive in my office. One is the CO2 and the other is the IPL. Because every single day I have more than one treatment, more than one patient for these indications, so that is what is happening usually. So doing also some surgery on the skin, for example, this part of the year that is close to summer, we reduce a lot the fractional CO2, for example. We are still doing procedures on scars because these patients know very well that you have to cover from the sun exposure. But we reduce the cosmetic procedure for the face because they want to do the weekend at the sea or on the beach. So we have to expose our patient to risks if they are going to directly to the sun. So I do not have a one single answer. It depends. Maybe in close, for example, I'll give you an example. Close to the Christmas vacation, I'm doing tons of fractional CO2 on the face. You know why? Because they are using the vacation of Christmas for the recovery period. So they have to ask any permission at job. They okay, I'm on vacation, and instead of going skiing that year, they decide to do a fractional CO2. Or there is a national vacation in Italy that is at the beginning of December, and if this vacation is one day, but if this vacation is close or to the weekend, they can take 4 days off without asking any vacation. And so that is another period that is very full of these just a little more aggressive procedures. Otherwise, I really love a procedure that you are not doing here in Korea. That is the combination of IPL plus the microneedle RF. That last year won the award as the best combined procedure in United States, as the combining during the same procedure IPL and microneedle RF with very short needles.
What is the main indications for IPL plus rejuvenation?
Rejuvenation, yeah. It's because if you look at your patients, there are patients that deserve a fractional CO2, okay, and then there are patients with not so severe defects that are okay with a classical photorejuvenation with IPL. But what to do in the middle? What to do for patients that deserve something more than a classical rejuvenation, but for example, they are not willing to accept 5 days off for crust with the fractional CO2. So for that kind of patients, combining these two technologies together, same session, we can achieve very, very good results as well.
Did you do the LARF and IPL treatment at the same day?
Same day, same session.
Is there any adverse effects after the treatments?
No, you know, it's I'm using. May I say the name of the device? I think so. So I'm using the Legend Pro Plus. The Legend Pro Plus is a radio frequency that has also the microneedle RF, and the microneedle, the length is 1 millimeter. So we do not need, for example, numbing cream. Okay, the patient is arriving and is doing the IPL first, that is taking care of the surface, so the blemishes, the brown and the red, as a classical IPL. But immediately just after, we use the microneedle RF that can penetrate the skin, okay? So why these two have a synergistic effect? These two have a synergistic effect because with the IPL, we increase the temperature of the skin. So we have higher temperature. And the other effect we have with the IPL is that we have more water inside the skin. So RF can be transmitted wider and deeper because we preheated the skin with the IPL. So it doesn't matter if you have only 1 millimeter needle, because we can arrive to 1.8, 1.9 millimeters in penetration. That is exactly mid-dermis of the cheeks, for example. That is exactly where we want to arrive. So we have no numbing cream. The patient is lying on the bed doing the procedure, and then she can go home or to work as she wants. Going back to the normal life in, you know, to the day after as a classical IPL, because they can have minimal fine crust. I don't ask them crust because there's no blood, but that's okay. Very fine crust, but they can cover that with the makeup, so I have no problem. So they have no problem.
You know, the Legend Pro is very new to me because in Korea the Legend Pro is not released yet. So
that's why at the beginning I said I do not know if I can speak, but that can be a sea change, you know, because it's covering patients that are deserving more than an IPL procedure, classical, or less than a fractional CO2, and these 15 minutes, 10 to 15 minutes more, but the combination is very good.
And you know, the Legend Pro, I saw some marketing phrases on the internet. It's marketed as offering immediate results, long-term efficacy, minimal pain and downtime, and no need for numbing. And is it right? Exact?
Marketing. No, yeah. The device says I'm using it only when I'm using the microneedle RF. Okay, so the other handpieces of the Legend Pro Plus is not for me, you know, is for my operators. So they are doing very good results for the skin laxity of the abdomen, for example, but it's not for me. I'm speaking about the medical part of the device, okay? And it's absolutely true that you do not need any numbing cream. It's absolutely true. When they do the IPL first, and then they do the microneedle RF after, they are saying, oh, this one, the second one, is less painful than the IPL. So if a patient is accepting the IPL, can do the RF without problems. I think that the secret there is to preheat the skin with the IPL that's in the same time as taking care of brown and red, and then arriving deeper because we preheated the skin. So immediate results, don't think so. We need time to have collagen production. So immediate results for IPL, sure. We are fragmenting melanin, we are coagulating vessels, so we have immediate results because of the IPL, but we have to wait time to have results because of collagen production due to the RF microneedle. So it's at the beginning, the patients are happy because they see less blemishes, okay? This is an initial results. But after months, they see less wrinkles and they're more happy. So immediate, the answer is yes and no. Yes, because of the IPL, if you are combining this. No, because of the collagen production. If we are speaking about microneedle RF. If you are speaking about the other handpieces, okay, you know that collagen has the muscle activation, dynamic muscle activation, DMA, that then stimulate just after the radiofrequency, the contraction of muscles. So in fact, if you look at the face of a patient with half face treated and half face non-treated, you can see a difference just after the procedure. But I do not think that this one will be a long-lasting results, is more immediate. So maybe it's good if someone has, a party or has some things to go to. But I'm very happy of that device because of the results we have with the needles. So and on the neck, I consider the neck my tomb. The neck is very difficult to treat. The neck,
yes.
Everyone is able to create a good face with, doesn't matter which kind of device. We can arrive at good results. But do you have in mind the ladies with good face and bad neck? It's classical because the neck is much, much more difficult. Yeah, and right. That microneedle RF for the horizontal wrinkles of the neck and for the aging process of the neck, the lower 2/3 of the neck, so when you have the creepy skin that is classical of all patients, that is a very good indication. In that case, some of my patients require numbing cream because they do not want to feel absolutely nothing. But the majority of them do not need any anesthesia.
The dorsum and
don't do that. Means that on the dorsum of the hand, I love to do IPL to remove the lentigos or to remove the blemishes, and then I love to inject some hyaluronic acid to try to reduce. But that could be. The only problem to remember is that the skin of the dorsum of the hand is very thin, as well as the décolleté, and so we have not to be very aggressive to avoid any kind of risks.
Yeah, back to the Legend Pro. But as I told you, I'm very new to Legend Pro, so how many hand pieces in Legend Pro?
Legend Pro is a three-porter. The three-porter doesn't mean anything, guys. Three-porter is a porter, doesn't mean anything because the poles are always two, minus and plus. What means three-porter? That the minus or plus are moving during the procedure to create more volume heating. That is what means we do not have three poles. We have two poles, okay? So we have that one. We have the one for the huge areas, and the Pro Plus has a small monitor on the handpiece, so you can realize the temperature there. That is very useful for the treatment. While for the microneedle, at the moment we have two kind of needles, two kind of length of needles. One is the 1 millimeter, and the other one is the 600 microns that I love to use when I'm using very thin areas like the neck, for example.
And how many cases have you currently experienced with Legend Pro? And what have been the results of the follow-up after the procedures, especially the satisfaction, the patients? How about
the only difficult session to manage is the second one, because they didn't see any results because of the first one, because it's too close to the first one. But when they arrive for the third and they started to see the results of the first session, they will continue and they want to go ahead. So it must be clear to my patients that collagen needs time to be produced. And we cannot have new collagen in 1 week. No technologies are able to achieve these results. So when I'm doing the second session, the collagen only started a few days before to be produced, and and my patients are not able to see results. They see a better skin because of the IPL if we combine them. They see no more lentigos. They are happy for that, but they are not seeing results on wrinkles because they did only one session. But when they are doing the other, they started to appreciate. And the other things that really, it's very important to me, it's very difficult to explain. They are saying to me, doctor, now when I'm touching the skin, I'm feeling a more healthy skin. So probably the texture of the skin, the feeling they have of their own skin is much better after. That is very common.
How many sessions do you do usually?
I start with 4, but on the extremely severe cases, I arrive up to 6. And the other thing that's very nice to say is that, okay, the winter after the procedure, the majority of my patients are coming back to my office saying, doctor, I want to do a couple of other sessions of this because I saw results and I want to keep that results.
I see.
So that is very interesting because I'm not saying them you have to come back in 1 year. No. But they are coming back by themselves asking for this because they realized they have not to stay outside the social life. They realize that they have results. They realize that it's not painful. So they have all advantages there, and so they said, why not to do a couple of sessions more?
Then does the most patients feel some changes after usually 2 sessions? After 2
yeah,
sessions, right?
I think so. They start to see good, means the initial results after 2 sessions.
With IPL treatments, you can decrease the sessions required for dissatisfaction, right?
If you are doing IPL first, they are happy after the first session because they see improvement of the surface.
Yeah, right. Blemish.
Exactly, and exactly. So they are convinced to come to the second one because they started to see results. But to be honest, these results are not because of the RF; it's because of the IPL. But that's why also combining is a great idea, I think.
You know, in Korea, it's common for doctors to use treatments for indications other than those officially approved. And do you think there is a possibility of applying Legend Pro for such off-label uses, other than?
I do not know how to answer. I think that we are delivering energy inside the skin. Okay. So how to use this, where to use this, I'm speaking anatomical regions, or how to combine this with other procedures. I think that this is absolutely free in the mind of single doctors. You know, I had the idea to combine with IPL because I was thinking, okay, there's heat, you know, the first and second ohm lows, and blah blah and blah blah. But you can combine that with you know what you want theoretically. We have to say if 1 + 1 is 3 and is not 2, means combined procedure doesn't mean that is 1 + 1. Yes, it's true, but the final results of 1 + 1 must be 3. Otherwise, it's not a combined procedure.
That's synergy.
It's only putting one after the other. So, and the physical explanation of why preheating with IPL having effect on blemishes and then followed immediately by the RF has a lot of physics behind, clinical effect, histological demonstration, so there's a lot of things there. So if the question is, may I experiment something with this device, I say, okay, if you are not doing something crazy, I think so. Remembering that you are delivering energy, and you are delivering energy with the same safety profile you are using. You're using all other devices in your hand. You know, it's not because you are not affecting directly the surface, but you are going deeper. That you are free to, you know, increase too much the energy or the pulse duration or something like this.
When you combined with the IPL treatments, then do you use the energy levels?
No.
The low energy levels, right?
No.
No? Same?
No. Same.
Oh, really?
Yeah.
That's quite interesting.
Because the aim of the IPL is to increase temperature in water means using the same amount of energy I was using without the IPL, I'm sure this way to arrive deeper and wider. So that's the reason. And at the beginning, I had the same doubts you have now, but then I saw the clinical results, and then I saw the post-op. So I was expecting more redness. I was expecting longer downtime.
I'm worrying about that.
And that's not true. That is absolutely not true. So yes, you know, some small crust, but it's the same as having the IPL before or not. IPL with some, you know, fine crust and darkening of the blemish is normal. So these are not adverse events. These are expected reaction to your procedure. So I didn't appreciate any prolonging. Yes, you know, I did tons of operations. Sometimes something happened, but it's not because of the procedure, because of the operator or that patient.